As hepatitis continues to affect millions of people worldwide, causing deaths of about 1.34 million people every year, the global community has been urged to raise global awareness about the virus.
The World Hepatitis Day, which is observed on the 28th of July every year, is dedicated to encouraging prevention, diagnosis and treatment of the virus, a group of infectious disease known as hepatitis A, B, C, D and E. TVC News senior correspondent Sharon Ijason reports.
On World Hepatitis Day, international bodies call on people from across the world to take action and raise awareness to find the missing millions. In Nigeria, public health practitioners are concerned about lack of access to vaccine, as most people diagnosed with hepatitis cannot afford treatment.
For adults and pregnant women, they don't have free vaccination. The free vaccination is only accessible to the newborn and to the infants. Infants are children that are less than 1 year. They benefit from the free vaccination. But for adults that are infected and pregnant women that are infected, they have to go out of their way to get the vaccine. And you know the problem in our country, being a developing nation, that most people living below $1 to $2 per day. How would they be able to afford such vaccine?
We should get to any facility close to us, any hospital, and get tested. If you test positive to hepatitis B, you see the liver specialists who take care of hepatitis B patients. If you test negative, you go for hepatitis vaccination. There are vaccines to prevent it. Hepatitis is actually a preventable disease.
Though World Hepatitis Day is one of World Health Organization's 7 official mandated global public health days, low coverage of testing and treatment is the most important gap to be addressed in order to achieve the global elimination goals by 2030.
I think we are all vulnerable, and that's why we also say this is an enemy against humanity, that humanity should stand in unison to fight and defeat it.
Mike Omotosho of the Hepatitis Zero Nigeria Commission speaks about efforts to eradicate the virus.
If you look around, you will notice only 12 countries are on track towards achieving this goal. And with less than 10 years to that set target, how prepared are we as a nation? That is the reason why the Hepatitis Zero Nigerian Commission has taken it upon itself to provide a platform where all stakeholders can come together to be able to provide the needed impetus to halt the transmission of hepatitis by the year 2030.
The 2020 World Hepatitis Day is themed Hepatitis-Free Future, with a strong focus on preventing hepatitis B among mothers and newborns. For this to be achieved, there is a need for all newborns to be vaccinated against hepatitis B at birth, followed by at least 2 additional doses.
Worldwide, 290 million people are living with viral hepatitis unaware. Without linking the undiagnosed to care, millions will continue to suffer and lives will be lost. Sharon Ijason, TVC News, Lagos.